Hello parents. This is Diana. Today, I'm sharing with you about 6 common issues you might face with your 4-week-old baby. Don't worry, you're not alone, and there are plenty of ways to handle these challenges. 1. Sleep challenges. You'll find that babies at this age are still figuring out their sleep patterns, so it's totally normal for them to wake up frequently for feedings or just for some comfort. What to look for? They might have trouble settling down, take short naps, or even confuse day and night. Yep, they're tiny night owls. What can help? A calming bedtime routine can work wonders. Think a warm bath, a feeding, and maybe some soft lullabies. During the day, let in lots of natural light, and at night, keep things quiet and soothing to help them differentiate between the two. 2. Feeding difficulties. You'll find that some babies might struggle with breastfeeding, like having trouble latching, or they could deal with gas or reflux. Signs to watch. Fussiness during or after feeding, frequent spit-ups, or even arching their back might be signs something's up. Tips. Make sure your baby is latching properly if you're breastfeeding. And whether you're breastfeeding or using formula, don't forget to burp them after every feeding. If reflux is an issue, try smaller, more frequent feeds. 3. Colic and gas. Colic. It's that dreaded word for many new parents. Some babies cry a lot, especially in the evenings, and gas can make it worse. What to look for? If your baby cries for more than 3 hours a day, 3 days a week, for more than 3 weeks, it might be colic. What can help? Gently massaging your baby's tummy or doing bicycle legs can help relieve gas. Holding them upright during and after feeding can also minimize air swallowing. And for the crying, swaddling, rocking, or even white noise can work like magic. 4. Skin conditions. You'll find that babies have such delicate skin, so it's not uncommon to see things like baby acne, diaper rash, or cradle cap. What you'll notice: red or flaky skin, rashes in the diaper area, or yellowish crusts on their scalp. How to handle it? Keep their diaper area clean and dry, and use a good barrier cream to prevent rashes. For cradle cap or baby acne, wash their face and scalp gently with mild baby soap. It usually clears up on its own. 5. Crying and fussiness. Did you know that crying is just a part of how babies communicate? But it can peak around 4-6 weeks. Sometimes, they'll cry even when they're fed, dry, and comfortable. What to do? Try different soothing techniques. Swaddle them snugly, rock them gently, or play white noise. Remember, it's okay to take a break if it gets overwhelming. You're doing a great job. 6. Umbilical cord healing. By now, the umbilical cord stump should have fallen off, but the area might still be healing. What to look for? Redness, discharge, or any unusual smell around the belly button area. Tips. Keep the area clean and dry. If you notice anything that doesn't seem right, check in with your pediatrician. A few final tips. 1. Bond and play. Tummy time, gentle talking, and play are great ways to engage with your baby and encourage development. 2. Ask for help. If you're ever worried about persistent crying, feeding issues, or anything else, don't hesitate to reach out to your pediatrician. 2. That's what they're there for. When should you call the doctor? Here are a few red flags to watch out for. 1. If your baby's crying doesn't improve no matter what you try. 2. Signs of illness, like fever, vomiting, or diarrhea. 3. Poor weight gain or a lack of interest in feeding. 4. Any redness or unusual discharge around the umbilical cord. Parenting a 4-week-old can feel overwhelming at times, but trust me, you're doing amazing. Every baby is different, and as you get to know yours better, you'll find what works best for both of you. If you think this video is useful, don't forget to like, comment, and subscribe to show your support. Have a nice day.